So my name is Maria Glover. I am the Cardiac Rehab Nurse Manager. I'm based here at the Heart and Lung Centre at New Cross Hospital, and we also run a service over at Cannock Hospital, as well as a variety of community venues as well. So my job role is the Cardiac Rehab Nurse Manager. So I'm based here at New Cross, as I say, and we have a team of 6 nurses who are cardiac rehab sisters, and we also have 3 exercise physiologists as well as 2 admin staff as well. So it's a nice team spread between here and Cannock, as I say, also in the community. And my job really is to ensure that all the patients that come through the Heart and Lung Centre diagnosed with any form of cardiac condition or cardiac surgery, it's my job to ensure that they get their cardiac rehabilitation in hospital before they go home, and also once they've gone home we do all their follow-up as well. They're pretty much on our books from the day of admission all the way through to discharge, and they can stay with us for up to 12 months and some further as well. So lovely job, and it's taking people through various stages of their rehabilitation. So I start at usually about 8 o'clock in the morning. We are a Monday to Friday kind of 9 to 5 service, so we come in first thing in the morning, we have a team huddle together whereby we decide who's going to be covering which ward. We've got a variety of wards here as well as outpatient clinics to cover. So it's my job to make sure that we've all been assigned to certain areas, and obviously then we will then go and see the patients on the ward. That's the first thing. We then prepare patients ready for discharge, and then after that usually takes most of the morning. Then come lunchtime, then it's then time to do all the follow-up patient care, which is the telephone calls and arranging clinics, and obviously planning their programs from there on in. And at that same time then obviously this is over both sites, and we're also covering the programs as well. So from a nurse point of view, we are in a variety of situations and places. I think the best part of the job for me is I've been a nurse for many, many years. I've worked on wards and I've worked in community. The best thing for me is seeing the patients when they come in, first and foremost, following diagnosis from quite a serious cardiac condition, and obviously see them improve as an inpatient and then see them ready for discharge. And the great thing for me is then I get to do all their follow-up care, and I see them go from strength to strength from the point of diagnosis then months and months down the line, and it's so lovely to see them recover, and that is definitely one of the best parts of the job. I think the key qualities are certainly you need to be a very good listener, you need to be very patient. I think the good part of my job is that because I manage my own caseload and my own times, I'm allowed, and I've got that time to spend with patients, to sit down and listen and really engage with them and their families to find out what they need, what their needs are, and we can actually then action that as an autonomous role. It's a very unique position to be in, and you, as I say, you do manage your own caseload and time. So you do need to have patience, but you also need to really think as a skilled individual, because you are working on your own as well. So it's a fantastic job, but it certainly does need a certain amount of counselling skills and certainly a good knowledge base as well. I think in cardiac rehabilitation it's lovely because we have all sorts of disciplines. We have nursing staff, we have obviously we have a lot of students and apprentices that come through as well. We also have the exercise component, so not necessarily physio, you can be physio, but you could also be occupational therapist. We involve with dietitians as well. So there's all sorts of disciplines that can come, and certainly from a cardiac rehabilitation point of view, in the world of cardiology, it's an ever-changing speciality anyway, so I think that there's always so many opportunities to keep your skills up to date, yeah.